Hello everyone, I am Dr. Chethan, consultant neurologist, Manipal Hospital, Varthur Road. We all know that time is money, but for a neurologist, time is brain. Why do I say that? A patient suffering with an acute stroke will be losing nearly 2 million neurons per minute. 2 million is 20 lakh neurons per minute. That's the reason if you find someone with an acute stroke-like symptom, please rush him to the hospital at the earliest. Today, 29th of October, is celebrated as World Stroke Day. The reason being, bring in awareness amongst the general population about stroke, how to identify stroke, what to do and what not to do when you come across such patients. So, how to identify stroke? Stroke is something which occurs all of a sudden. If you are in a function, a party or something, if someone develops sudden onset weakness involving one side of the body, a speech difficulty, a slurring in a speech, a facial deviation, sudden onset walking difficulty, any such symptom which is all of a sudden, just rush into the hospital immediately. It could be stroke. Apart from this, there are one set of patients who wake up with these symptoms. They would be all right when they are asleep, and they wake up with this symptom. Even this is an emergency. You have to rush them to the hospital as soon as possible. Of course, there are certain things which you can do at home. You can check his blood pressure, you can check his blood sugar. If the sugar is low, of course, you can give some oral sugar, but make sure you bring him to the hospital for a further evaluation. In our practice, we see that a lot of patients with stroke kind of symptoms present late to us in the OPD. The reason is, if someone gets this symptom, they try to call their friends or neighbors to ask for a contact of a good neurologist. Then they try to book an appointment online, which delays the whole process by few hours. Please don't do this. Stroke is an emergency. You do not have to wait for an OPD appointment for this. You just have to land in the emergency room. The rest of the things will be taken care by the emergency doctors. The other reason for delay is Googling. Some people Google their symptoms, they try to rationalize the symptoms, saying that it could be a nerve compression, saying that they would have slept on their hand resulting in weakness, saying it could be a gas-related problem, and so on and so forth. Please don't do that. Any sudden onset symptom, come to the hospital as soon as possible. And to conclude, I would just like to say, time is brain, and a stitch in time saves 9. Thank you.